So I see it's 1 o'clock, so we're gonna start. My name is Natalie. I'm working for the Better Project, and I welcome you to this webinar on sleep. We all know that sleep is very important, but so challenging for people living with T1D. Health professionals rarely address this question during medical visits. So what does science know about sleep in the context of type 1 diabetes? Can you improve your sleep quality? So to answer those questions, we have a special guest today, Lidiane Vesnaim. Before introducing her, just a quick reminder, if you have any question during the presentation, please use the Q&A section, and we will try to answer as many of them at the end of the presentation. Thank you very much. So, among other things, Lidiane is a researcher at a research center in Quebec called VITAM. She also holds the associate professor position in the Department of Health Science at the Université du Québec à Rimouski. She followed an impressive academic path, a bachelor's degree in psychology with a research concentration, a master's degree in community health, a doctorate in nutrition, a postdoctoral research with a 2-year fellowship on sleep in Houston in the United States. She also held a postdoctoral scholarship in knowledge translation in diabetes care and its complication at the Institute of Nutrition and Functional Food and at the Center for the Study of Sleep Disorders at Université Laval in Quebec, sponsored by Diabetes Action Canada. Currently, her research focuses on documenting and studying beliefs regarding sleep habits among adults living with diabetes, intending to develop interventions to promote healthy sleep habits in this population. She also analyzes data from the Better Registry. So Lidiane, welcome. I hope I introduced you properly. So now the floor is yours.
Right. Thanks for the introduction. So I'm happy to present today on sleep and type 1 diabetes. So what do we know? Okay. So here's the outline of the presentation. We're going to have 2 opening quiz questions. We're going to look at what is sleep, also look at sleep recommendations in Canada and elsewhere, and also answer the question, why is sleep important when living with diabetes? I'll present you a few of our research results on sleep and diabetes, and also a future project on sleep and diabetes using data from the Better Registry. We're going to have a conclusion, a closing quiz, and I want to end by giving you a few sleep resources if you're interested in improving your sleep. So opening quiz, first question, it should appear on your screen. Have you ever experienced sleep difficulties? Yes or no? So I invite you to answer the question, and we're going to look at the results together.
For my part, I cannot answer the question. I don't know if it's
it's
normal.
It doesn't work?
Not for me.
There you
go.
Oh, okay. Yeah. Okay. Now okay. I see it too. Okay. Right. So I think people should have had time to answer the question.
People are still recording their answer, but we can say approximately 94% answered yes.
Whoa, okay, so many of you have already experienced sleep difficulties, which is not surprising. I mean, it's okay to have a bad night's sleep once in a while. It becomes pathological if you've had it, like if you have it for every night for many months. So, okay. Okay, so next question. During a diabetes appointment, has a healthcare provider, like an endocrinologist, a family physician, a nurse, or a pharmacist, ever asked you about your sleep? Yes or no? So hopefully you see the question on your screen and you can answer it. Okay, Natalie, can we see
Yeah.
the results?
We see that 83% answered no.
Okay, so we've seen that previously 94% of you said that you've had sleep issues, but almost the same number, 83% said, but you've never really been asked about your sleep during an appointment. So that's interesting. We're going to come back to that at the end of the presentation. This is just to know how many of you have had sleep issues and if sleep is something that you sometimes discuss with a healthcare provider. Okay. Okay, so what is sleep? So here's a definition from the Oxford Dictionary. It's a regularly recurrent condition of body and mind in which the nervous system is inactive, the eyes closed, the postural muscles relaxed, and consciousness practically suspended. Sleep is essential for many things, but especially for physical health, mental health, and for quality of life. Sleep used to be seen in terms of sleep quality, and one of the most commonly used instrument to measure sleep quality is the Pittsburgh Sleep Quality Index, and this instrument measures 7 components of sleep quality. The first one is subjective sleep quality, which is how you would evaluate your sleep. For example, poor, moderate, good. Sleep latency, which is the time it takes to fall asleep at night. Sleep duration. Habitual sleep efficiency, which is the proportion of time spent in bed sleeping over the total time spent in bed. So it accounts for sleep disturbances at night. There's also sleep disturbances, which is having to use the bathroom at night or having nightmares. The use of sleeping medication and daytime dysfunction, which is trouble staying awake during daytime. More recently, we've been talking about sleep health. And good sleep health is characterized by 5 things. The first one is regularity. So you should have more or less 1 hour of difference in your bedtime and wake up times, including on weekends. Satisfaction. So when you've got good sleep health, you'll be satisfied with your sleep. You should be able to maintain alertness all day without dozing. Timing is also important. So according to this definition, you should be asleep between 2 and 4 a.m. Also sleep efficiency. So according to this definition, you should spend less than 30 minutes awake at night, and adequate duration, which according to this definition is between 6 and 8 hours a night. But we're going to look later on the presentation about what are the Canadian sleep duration recommendations. Sleep health was also added by the American Heart Association in 2022. So it became Life Essential 8 thanks to the addition of sleep health. So it was recognized as a factor that can contribute to cardiovascular health. So let's look at the sleep recommendations. So in Canada, there are a few sleep associations. There's the Canadian Sleep Society that has a Canadian public health campaign on sleep called Sleep On It. At the end of the presentation, I'll give you the link to their website. There's a Canadian Society for Exercise Physiology that has sleep durations recommendations for different age categories. The early years, so 0 to 4 years, children and youth, 5 to 17 years, adults that are 18 to 64 years, and adults 65 years and older. If you look at the Canadian sleep durations recommendations from the Canadian Society for Exercise Physiology, in adults that are 18 to 64 years, it's 7 to 9 hours of sleep per night. And in adults 65 years and older, it's 7 to 8 hours of sleep per night. There are also some sleep associations that are outside of Canada. Internationally, there's the World Sleep Society that organizes each year a World Sleep Day to make sleep as something to kind of make sleep as something important, and it happens in March. This year it was on March 15, and they have a different theme each year. This year it was Sleep Equity for Global Health, and in the United States they've got the National Sleep Foundations that have sleep durations recommendations for different age categories. So newborns that are 0 to 3 months, toddlers that are 1 to 2 years, children that are 3 to 13 years, teenagers that are 14 to 17 years, adults that are 18 to 64 years, and adults that are 65 years and older. If you look at the American sleep duration recommendations from the National Sleep Foundations, in adults that are 18 to 64 years, it's 7 to 9 hours of sleep per night. And adults 65 years and older, it's 7 to 8 hours of sleep per night. So we can see that the sleep durations recommendations in the United States are exactly the same as they are in Canada, or at least for those 2 age categories. There are also what we call healthy sleep habits, which are behaviors that can promote sleep. Here is an example of 5 healthy sleep habits from the National Sleep Foundation. The first is going to bed and waking up at the same time every day, setting a relaxing bedtime routine like reading a book, exercising regularly, There's turning off electronics 1 hour before bedtime and avoiding caffeine, alcohol, and nicotine before bedtime. Here also, we have 6 tips for healthy sleeps by the National Sleep Foundation in the United States. The first one is related to light. So spend time in bright light during the day, natural light or equivalent brightness. The second is related to exercise. So exercise regularly for deeper sleep. Aim for 30 minutes a day, 5 days a week. The third one is related to mealtime. So eat your meals at consistent times day after day. The fourth is related to avoid. So avoid heavy meals, nicotine, caffeine, and alcohol before bedtime. The fifth is related to winding down. So use a consistent routines with a relaxing wind down to help you get the sleep you need each night, 7 to 9 hours for most adults, with the same sleep and wake times. And the sixth one is related to your environment. So put your devices away an hour before bed and sleep in a quiet, cool, and dark environment. So why is sleep important when you're living with diabetes? So the consequence of short and poor sleep quality among adults living with diabetes, and that includes type 1 and type 2, there are some risk of hyperglycemia, which increases risk of complications like retinopathy and foot lesions. It can also have a negative impact on quality of life and impact functional outcomes like having difficulty concentrating and participating in social activities. When we're talking about sleep, type of diabetes is important. In type 1 diabetes, people use insulin in the form of injections or pump. There's a management of glycemia at night, so it can mean the need to wake up in the middle of the night to treat hypoglycemia or hyperglycemia. In the case of hyperglycemia, it's associated with lower overnight secretion of melatonin, which is an hormone regulating the sleep-wake cycle, and it can also increase the need to urinate at night, which is going to disturb your sleep. If you've got type 2 diabetes, not every people who are living with type 2 diabetes is taking medication to treat their diabetes. And they may take oral medication instead of injections of insulin, which could probably be less disruptive for sleep at night, but they are at higher risk for sleep apnea. So what do diabetes associations say about sleep? In Canada, it's Diabetes Canada. They've got the clinical practice guidelines. The latest are from 2018. And in them, there is nothing on sleep. And the same also applies to the 2020, 2021, 2022, and 2023 updates in addition. The recommendations only pertain to diet and physical activity. If we look in the United States, it's the American Diabetes Association. They've got the standards of care in diabetes. They added sleep as a behavior to monitor among people living with diabetes in 2019. And they added new sleep health recommendations in 2023 and this year in 2024. So this year, in 2023, they added screen for sleep health in people with diabetes. And this year, they added to counsel people with diabetes to practice sleep-promoting routines and habits like maintaining a consistent sleep schedule and limiting caffeine in the afternoon. Some healthy sleep habits can also impact glycemia in adults living with type 1 and type 2 diabetes. So caffeine consumption can increase glycemia, and sleep timing variability can also negatively impact glycemia. We're now going to look at a few of our research results on sleep and diabetes. The first study is on sleep and healthy sleep habits among adults without and with diabetes, and that includes type 1 and type 2. So we had 151 French-speaking participants that were 18 to 64 years from the province of Quebec, 97 adults without diabetes, and 54 adults living with diabetes, 30 with type 1 and 24 with type 2 diabetes. In terms of data collection, we had a measure of sleep quality, insomnia severity, and 3 healthy sleep habits. So avoiding screen use in bed, having a regular sleep schedule, and avoiding caffeine, alcohol, and nicotine before bedtime. Here are the results on sleep according to the presence of diabetes. So in the first column in blue, you've got people that did not have diabetes. And in orange, you had people with diabetes, and that includes type 1 and type 2. And here for sleep quality, a higher scores indicates poorer sleep quality. And here, if for insomnia severity, a higher scores indicate greater severity of insomnia. So what we could see is that in adults living with diabetes were at higher risk for poor sleep quality and greater severity of insomnia compared to adults without diabetes. If we look at the results according to type of diabetes, so in the first column in blue, you've got people with type 1 diabetes, and in the second column in orange, you've got people with type 2 diabetes. So what we could see is that adults living with type 2 diabetes were at higher risk for poorer sleep quality and greater severity of insomnia compared to people living with type 1 diabetes. If we look at the results on avoiding screen use in bed, so which is a healthy sleep habits, so we were asking them about what are the barriers and the facilitating factors. So the facilitating factors are in orange. A facilitating factor is something that when it's there, it makes it easier to adopt the behavior. On the opposite, the barrier in blue, it's something that when it's there, it makes it harder to adopt the behavior. It's something you've got to overcome. So in adults without diabetes, they perceive more facilitating factors in orange than barriers in blue when it came to avoiding screen use in bed. While on the opposite, in adults with diabetes, and that includes type 1 and type 2, they reported more barriers when it came to avoiding screen use in bed. So this seems to indicate that in adults with diabetes, avoiding screen use in bed was perceived to be more difficult than in adults without diabetes. The second healthy sleep habits was adopting a regular sleep schedule. Again, in adults without diabetes, they perceive more facilitating factors than barriers when it comes to adopting a regular sleep schedule. On the opposite, in adults with diabetes, they perceive more barriers than facilitating factors when it comes to having a regular sleep schedule. So this seems to indicate that in adults with diabetes, adopting a regular sleep schedule was perceived as being more challenging than in adults without diabetes. And the third healthy sleep habits was avoiding caffeine, alcohol, and nicotine before bedtime. In adults without diabetes, they perceive the same numbers of facilitating factors and barriers. So the same numbers of things that could make it easier or harder to adopt that behavior. While in adults with diabetes, they perceive more barriers, so more things that would make it more challenging to avoid caffeine, alcohol, and nicotine before bedtime. So this seems to indicate that in adults with diabetes, avoiding caffeine, alcohol, and nicotine before bedtime is perceived to be more difficult than in adults without diabetes. Our second study was on sleep and healthy sleep habits among adults living with diabetes, so exclusively among adults living with diabetes. And that one had, again, type 1 and type 2 diabetes. So we had 320 French-speaking participants that are 20 to 86 years living with diabetes from the province of Quebec, 125 with type 1 and 195 with type 2 diabetes. In terms of data collection, a measure of sleep quality, a measure of sleep health, a measure of insomnia severity, and we also measured, again, 3 healthy sleep habits. So avoiding screen use in bed, except those that are used to monitor blood glucose levels at night, having a regular sleep schedule, and avoiding caffeine, alcohol, and nicotine before bedtime. Here we've got sleep duration among adults living with diabetes. So I remind you that includes type 1 and type 2. So in adults that are 18 to 64 years, the recommendations is 7 to 9 hours a night. So here there was almost 60% of adults living with diabetes that are 18 to 64 years that were sleeping 7 to 9 hours a night. While in adults 65 years and older, the recommendations is 7 to 8 hours a night. And here it was actually more the opposite. So more than 60% of adults 65 years and older mentioned not sleeping 7 to 8 hours a night. If we look at sleep quality among adults living with diabetes, so the average sleep latency, which is the time it would take you to fall asleep at night, was around 47 minutes, while it's usually around 10 to 15 minutes. So this seems to indicate that in adults living with diabetes, it would take them more time to fall asleep at night. Sleep efficiency, which is the proportion of time spent asleep over the total time spent in bed, was around 83%, while usually it should be around 85%. So probably we've seen that it would take them more time to fall asleep, and probably also adults living with diabetes are probably waking up at night, which would lower their sleep efficiency. Adults living with type 2 diabetes were at higher risk for poor sleep quality compared to adults living with type 1 diabetes. And adults living with diabetes with a gross annual household income of less than $60,000 were also at higher risk for poor sleep quality. If we look at sleep health among adults living with diabetes, the total time in bed on weekdays was around 8 hours, while the total time in bed on weekends was around 9 hours. The average sleep deficit, so the sleep deficit was measured by asking people how many hours of sleep do you think you need, and we would look at how many hours of sleep they would get on weekdays. So they would sleep around 30 minutes, 37 minutes less than they thought they would need. So this was the average sleep deficit. The sleep duration variability between weekdays and weekends was around 67 minutes. So we've seen here that people would usually spend an hour more in bed on weekends. If we look at insomnia among adults living with diabetes, so the proportion in our sample that mentioned having insomnia symptoms, I remind you that's type 1 and type 2 diabetes included, it was around 70%, while in the general population in Canada, in adults that do not have diabetes, it's usually around 37%. So this seems to indicate that in adults living with diabetes, twice more have insomnia symptoms compared to adults without diabetes. If we look at insomnia, in our sample, around 50% of adults living with diabetes reported having insomnia, while in the population of adult population that do not have diabetes, it's usually around 20%. So again, this seems to indicate that twice more adults living with diabetes have insomnia compared to adults without diabetes. And if we look at clinical insomnia, in adults living with diabetes, it was around 25% that reporting having that. While in the adult population that does not have diabetes, it's usually around 10%. So again, twice more adults living with diabetes had clinical insomnia compared to adults without diabetes. If we look at the proportion of adults living with diabetes who reported using screen in bed, so a little bit less than 30% mentioned not having done that in the last month. So that means that more than 70% of people actually did it. And when people would use their screen in bed, the vast majority would do it every day. So this seems to be something that is common and also frequent among adults living with diabetes. Oops, sorry. So avoiding screen use in bed was perceived as being difficult. It was an ingrained habit. It was particularly among young adults living with diabetes. And adults living with diabetes mentioned that removing alerts on cell phone and tablets might be something that could help them avoid screen use in bed. And this might make you feel maybe a little bit better if you are using your screens in bed. It was not the healthy sleep habits that was the most strongly associated with poor sleep quality, poor sleep health, and greater severity insomnia. But still, I do not recommend that you use your screens in bed. If we look at sleep timing variability among adults living with diabetes, so here, less than 12% said they did not have sleep timing variability in the last month. So this seems to be something that is quite common. But it seems that when people have sleep timing variability, it's less than once a week, or in majority less than once a week, or 1 to 2 times a week. So we can think that it's probably on weekends. We've seen previously that people seem to spend more time in bed on weekends, and they probably go to bed later on weekends. Adopting a regular sleep schedule was perceived as being difficult. Here it was women and young adults living with diabetes that were at high risk for having sleep timing variability. An important barrier was having too many things to do in the evening, like work, studies, or taking care of children, which is possibly making people go to bed later. It was the healthy sleep habit that was the most strongly associated with poor sleep quality, poor sleep health, and greater severity insomnia. If you look at caffeine consumption before bedtime among adults living with diabetes, so more than 50% of adults living with diabetes reported not consuming caffeine before bedtime. So it's not as common as screen use in bed or sleep timing variability. It seems when people do consume caffeine before bedtime, it's usually less than once a week. So it does not seem to be something that is as recurrent as screen use in bed. Here it was young men that were at the highest risk to report consuming caffeine before bedtime. It was the second healthy sleep habits that was the most strongly associated with sleep. So that means that consuming caffeine before bedtime was significantly associated with poor sleep quality, poor sleep health, and greater severity of insomnia. Now, the future project on sleep and type 1 diabetes using data from the Better Registry. So it will be a study on sleep quality among adults living with type 1 diabetes. We're going to be using data from adults, so those that are 18 years and older of the Better Registry. There are 2 objectives. The first one is to describe sleep quality among adults living with type 1 diabetes. And the second is to verify if certain sociodemographic characteristics, diabetes-related, psychological, and behavioral variables are associated with poor sleep quality. So that project has a couple of strengths compared to the studies 1 and 2 that I've presented on sleep and diabetes. The first one is that it's a larger sample of adults living with type 1 diabetes. So in the Better Registry, approximately 4,000. And also this one will include French and English-speaking adults from many provinces of Canada. So the previous two studies that I've presented, it was only French-speaking adults from the province of Quebec. So in the Better Registry, it should be more representative of the whole Canada. Here's what we're going to be testing. So we're interested what has an impact on sleep quality among adults living with type 1 diabetes. We've got 4 categories of variables: sociodemographic data, diabetes-related variables, psychological variables, and behavioral variables. In terms of sociodemographic data, we're going to look at the impact of biological sex, gender, menopause, number of children, age, ethnicity, the body mass index, socioeconomic status, and whether people have shift work. In terms of diabetes-related variables, we're going to look at the impact of the duration of the type 1 diabetes diagnosis, glucose monitoring method, for example, if they're using continuous glucose monitoring, treatment type, for example, if people are using an insulin pump, history of nocturnal hypoglycemia, history of hyperglycemia. In terms of psychological variables, whether people have fear of hypoglycemia, diabetes, distress, and stigma, level of well-being and depression, and the presence of social support. And in terms of behavioral variables, snacking before bedtime, which could possibly help prevent hypoglycemia at night, alcohol and cannabis consumption, and physical activity. The anticipated outcomes for the future study on sleep among adults living with type 1 diabetes, it's going to be able to answer 3 questions. The first is how serious are sleep problems, so to determine if many adults living with type 1 diabetes in Canada have poor sleep quality. The second is who should be prioritized when aiming to improve sleep quality. Should we focus on people based on their biological sex, their gender, maybe their age, or their socioeconomic status? And what can be done to improve sleep quality? What should be the targets of intervention? Should we focus more on diabetes-related, psychological, and or behavioral variables, depending which one are the most strongly associated with sleep quality? In conclusion, if I conclude on sleep, sleep is particularly important among adults living with diabetes compared to adults without diabetes. Adults with diabetes, especially those with type 2 diabetes, are at higher risk for poor sleep quality and insomnia. Adults living with diabetes, and this time it's type 1 and type 2, reporting a gross annual household income of less than $60,000 were at higher risk for poor sleep quality. This is what we call sleep health disparities. If I conclude on healthy sleep habits, adopting healthy sleep habits, especially having a regular sleep schedule and avoiding caffeine before bedtime, are particularly important among adults living with diabetes because we've seen that they seems to be strongly associated with sleep, but also can have a direct impact on glycemia. Compared to adults without diabetes, adults living with diabetes, and that includes type 1 and type 2, perceive that adopting healthy sleep habits is more challenging. And adopting a healthy sleep habits among adults living with diabetes varies based on age and biological sex. The recommendations that we can make is that sleep health should be monitored among adults living with diabetes and be included in the next clinical practice guidelines of Diabetes Canada. Adults living with diabetes reporting sleep issues should have access to inexpensive behavioral sleep interventions. Age and biological sex should be considered when developing interventions aimed at promoting healthy sleep habits among adults living with diabetes. And adopting a regular sleep schedule and avoiding caffeine before bedtime are 2 healthy sleep habits that should be prioritized to avoid complications among adults living with diabetes. So now a concluding quiz. It should appear on your screen. Are you now considering talking about sleep with a healthcare provider at your next diabetes appointment? So please answer at the question, and we're going to look at the results together.
We can say that about 67% answered yes.
Okay, so that's nice. So it seems like a few of you are now considering talking about sleep with the healthcare provider at your next diabetes appointment. So hopefully this will encourage Diabetes Canada to include sleep as something to monitor in their next clinical practice guidelines like they did in the United States. So a few references that I've cited during my presentation. I do want to make a few acknowledgements. So I've presented some research results. Obviously, it was a team effort. So the first study, the funding came from Diabetes Action Canada. I also want to thank my postdoctoral mentors. Also had some assistance with the quantitative and the qualitative analysis, and also some assistance with recruitment. So for this study, we had for the province of Quebec, Diabète Québec, and from the region of Quebec, Les Diabétiques de Québec, which is now called Diavi, and of course the study participants. For the second study, the funding came from Centre de Recherche du CIS de Chaudière-Appalaches and Fondation de l'Hôtel-Dieu de Lévis, also some collaborators, co-investigators and collaborators. And I also want to thank Diabète Québec from the province of Quebec, and Diavi from the region of Quebec, the manager of the 4 hospitals from the region of Chaudière-Appalaches, and the people of Dormez là-dessus, who helped with recruitment. And also I had some assistance with putting the questionnaire online, and of course the study participants. For the future study, I want to thank funding, so Centre de Recherche du CIS de Chaudière-Appalaches and Fondation de l'Hôtel-Dieu de Lévis, my co-investigators and collaborators, including the patient partners of Better, who helped shape the research question. And also thank you as participants of the Better Registry. Thanks to your data, we're going to be able to see what can we do to make adults living with type 1 diabetes have better sleep quality everywhere in Canada. So I said I wanted to give you a few sleep resources if you're interested in knowing more about sleep. So if you're interested in the Canadian Public Health Campaign on Sleep of the Canadian Sleep Society, it's called Sleep On It. If you're interested in the sleep duration recommendations in Canada, it's the Canadian 24-hour movement guidelines from the Canadian Society for Exercise Physiology. If you're interested in tips from the United States, it's the National Sleep Foundation. If you can read French and you're interested in what's done in France, it's Institut National du Sommeil de la Vigilance. If you're interested in participating in sleep research, there's the Canadian Sleep Research Consortium. You can sign up to become a participant. In the province of Quebec, it's Réseau québécois de recherche sur le sommeil, or Quebec Sleep Research Network. They do have a website in English. And if you're interested in what's done internationally, it's the World Sleep Society. So I want to thank you for your attention. I'll be happy to answer your questions, and I've put my personal contact information if you prefer to reach out by email.
Thank you very much, Viviane. That was very interesting. We have only 2 questions for now, but if you have any question, it's time to go and put them in the Q&A section. So the first one is, what do you consider the inexpensive sleep modifications mentioned?
Okay, so I was saying that people should have access to inexpensive behavioral sleep interventions. So when I was saying that is that some of the results are saying that adults living with diabetes that have an income of less than $60,000 or more at risk for poor sleep quality. So obviously we can't have a very expensive one-on-one counseling to improve sleep. And what I was recommending is mostly behavioral interventions and not pharmacological interventions. So what can be done that is inexpensive is improving your healthy sleep habits. So having a regular sleep schedule, including on weekends, avoiding screen use in bed, and also avoiding caffeine, alcohol, and nicotine before bedtime. So those are not very expensive, and they are likely to improve your sleep quality, your sleep health, and lower your severity, your insomnia severity.
Thank you. Second question here. Can you comment on very low 1% deep sleep score? Is there a link with T1D? How do you improve my scores? Well, I guess he doesn't have a really good sleep score.
Yeah, I can't really comment on that. I mean, I don't know. I don't really know the whole picture. I recommend that if you think you've got sleep issues, try to talk about it at your next diabetes appointment, or you can also maybe see a pharmacologist, pharmacist, if you think that maybe a pharmaceutical treatment is needed, or a doctor. Obviously, I can't prescribe any of those, but yeah, and be careful of all those apps that are out there. So I know a lot of people are. We've got our watch, we've got apps on our cell phone that can measure our sleep. I mean, it's interesting, but sleep should not, sleep is important, but it should not become, you should not be too worried about your sleep either, because that's going to be counterproductive. It's not going to help with your sleep. And those apps that are out there are not necessarily all validated. So they may give you a score, but it doesn't mean that it's measuring well your sleep. So.
We have two participants that want to know a little bit more about sleep and perimenopause.
So, okay, so in women, there are many things that can impact sleep. There's being in your period will have an impact on your sleep. Pregnancy and menopause is a big one too. So a lot of women start having sleep issues around that menopause, especially with the heat. What's it called? When you're have
Heat waves? No, I don't know.
Heat flash.
Yeah.
When you're warm at night. I don't really remember what the name is in English, but when you're warm at night, it's going to disrupt your sleep. What I recommend is that if you think that it's really a big issue, that yes, you should talk about it with a doctor or a pharmacist about it. But it's normal that around menopause, many women unfortunately start having sleep issues. So.
Thank you. So in regards to the Better Sleep study, will this be information taken from previous submitted info questionnaire, or will this be a new questionnaire?
No, so we're going to be we've already started analyzing the data. So it's not a new study. We already have data on people's sleep. So this is why we encourage you to do the whole, because the sleep questions are like in the last questionnaire. So it's only people that decided to answer the whole questionnaire, and we already have all that data. So it's not going to be a new study. But if we see that sleep is a big issue, this could encourage to maybe get additional funding and maybe add some new questions to further ask about sleep, or maybe specific sleep issues, maybe insomnia. Some people were asking about apnea, hypersomnia. So that could be things that we could include, but for the moment, there's no data on that in the Better registry, but we do have sleep quality. So.
Thank you for that. Another participant is asking, what do you recommend regarding the use of a sensor alarms at night? Should one turn off alarms at night? I don't think so. I don't think it's possible to turn off like the Dexcom, for example.
I don't know if you can turn off those. I mean, yes, sleep is important, but you don't want to put yourself at risk of having a major hypoglycemia or even hyperglycemia. So remember when I was saying screen use in bed, and I said except those that are used to monitor blood glucose at night, is that we're encouraging people not to use screens in bed. So that's television, cell phone, smartphone, laptop, tablet. So we're encouraging that, but we are making an exceptions for all those that are used to monitor blood glucose at night. So I think this would be actually dangerous to turn it off. So it's bad. It's going to wake you up at night, but it could save your life. So yeah, sleep is important, but you know, being alive is important. If you're not alive, you won't be able to sleep. So
yeah, it's more important, I think.
Yeah.
Someone answered our question. It's hot flashes.
Hot flashes. Yes. Sorry. Yeah.
Yeah. Another question is here. Do you have any actual H1C numbers and links with sleep quality?
You mean like a particularly
probably about like what's your H1C, like if you're at 7 or 15, is there a difference? I guess that's what the person
all I can tell you is that either hypoglycemia or hyperglycemia can have an impact on sleep, but I don't have an exact value though.
There are no studies comparing, like for example, your values and related to the sleep quality, for example.
I haven't seen that. That's very, very precise information. All they say is that they've done some studies and most of the studies are actually done with people living with type 2 diabetes. There's a lot less done with type 1 diabetes. And I haven't seen if they were able to pinpoint the exact value at which it's going to impact your sleep. And I'm thinking there's probably some personal variation there. Just like when we're doing some examples about the avoid caffeine before bedtime, it's going to vary from one person to another. So I'm thinking probably the sensitivity that is going to of your glycemia on your sleep, it probably has also some personal variations.
There's so much research that need to be done anyways on that matter.
There is, like I said, most of it is done with type 2 diabetes. There's a lot less with type 1, but thanks to the Better registry, now we've got data. So.
There's no more questions. I have one though. Is there any research on children? Because we know that's a challenge for parents having children living with type 1 diabetes. Do you think it's the same than for adults or?
There isn't, and I haven't really seen some data for that. And I remember when we had the meeting with the patient partners, some people mentioned that. What about parents of have a child that has type 1 diabetes is going to disrupt their sleep, right? Because of the alarm at night. Unfortunately, in the Better Registry, there isn't that data, but like I said, if we see that it's a major issue and we decide that we can add some information or add some questions, maybe we could have that, because obviously a parent knowing that their child might have hypo or hyperglycemia at night, it's going to wake them up, it's going to disrupt their sleep. So yes, probably it has an impact, but unfortunately there's not really data on that, but that's very interesting. And we also know that sleep is also important. Well, it's important for everyone, but it's also quite important for children, and even adolescent could be interesting too. So once they become adolescent and they start managing more their type 1 diabetes and becoming more independent, could be also a critical period to look at their sleep and how their diabetes impact their sleep and their diabetes management at night.
Yeah, that would be very interesting to know. And there's a lot of people thanking you, saying that it was a really informative session. So compliments to you.
Thanks. Another things that some people came up to with, it's making me think about that, is also being the partner. So obviously when you're waking up at night, some people were mentioning that also they do not have type 1 diabetes, but their partner does. So it would also wake them up at night, the alarm. So they say maybe you should also consider the partner, especially if you're sharing a bed. So that also could be interesting, but unfortunately in the Better Registry, we don't have that data yet, but that could be interesting.
There's one last question that popped up. It's about the Phénomène de l'eau. What is there something to do with the Phénomène de l'eau? I don't know what it's in English, but I guess this person knows French.
So it's normal. Okay, so and everyone, whether you've got diabetes or not, it's normal that your glycemia is going to have an impact in the morning. It's actually going to help you wake up in the morning. So as far as I know, it's normal. As far as I know, if you've had diabetes for a while, you're used to having that. I don't remember what it's called in French. I don't know if it's called morning.
It's Phénomène de l'eau.
It's called exactly the same in English.
I don't know in English.
Yeah, morning phenomenon. I'm not sure,
maybe,
but yeah.
Maybe someone in
it's
the audience
normal.
knows.
It's normal.
Dawn phenomenon.
Dawn phenomenon. Okay.
Thank you again, Miriam.
Yeah.
Okay, yeah. So it's not related to sleep actually. It's more about your glycemia and
yeah, it's something that your body does to help you wake up in the morning. You're gonna wake up if you see light, depending if you got good blinds or not. That's gonna you're gonna also wake up because you're gonna have a change in your body temperature. But also because of that, your change in your glycemia is gonna also wake you up in the morning.
Yeah, so the strategy is more to play, if I can say, with your insulin dose.
Yeah, if
this issue.
to account for that, there's going to be the dawn phenomenon. Yeah.
Okay, let me see if there's another one. No, there's nothing else. Anyway, it's 1:43, so I guess we can close this presentation. Thank you very much again. Thank you all for being here. And if you have friends, family who don't know about the Better Project, please share our websites. And if you have friends with T1D, also maybe you can talk about the Better Registry. If they are not in it, maybe you can talk about it and let them know about it. So because we need more participants to have a better view of T1D in Canada. But thank you all and have a really nice day.
Thank you.
Bye.